And
Bismillahirrahmanirrahim. The quote for today is, "And your Lord has said, Say unto me, and I will hear your prayer." Today we are going to discuss about the trachoma. I am Dr. Muhammad Abbasgil, PGR Community Medicine from the King Edward Medical University, and I am giving this presentation under the supervision of Professor Saira Afzal. The learning outlines of today's presentation will be the introduction about the chlamydia trachomatis, its epidemiological determinants, clinical progressions, complications, prevention and treatment strategies for trachoma, and at the end will be the recent updates and MCQ session. By the end of this presentation, participants would be able to describe about the trachoma, its clinical progression, epidemiological determinant, prevention, and treatment strategies. No, let me introduce you the disease that what is the trachoma. It's a disease that is caused by a bacteria that is known as Chlamydia trachomatis. It is transmitted from person to person. It has its multiple infections lead to visual impairment and blindness. Blindness from trachoma is irreversible. Now, the problem statement related to the trachoma is that trachoma is the leading infectious cause of blindness worldwide, and it is responsible for the blindness or visual impairment of about 1.9 million people. It causes about 1.4% of all blindnesses worldwide. Blindness from trachoma is irreversible. It is a public health problem in 38 countries, and based on June 2024 data, 103 million people live in trachoma endemic areas. Trachoma is hyperendemic in many of the poorest and most rural areas of Africa, Central and South America, Asia, Australia, and Middle East. Overall, Africa remains the most affected continent and one with the most intensive control effects. Now, the economic impact of trachoma. The economic cost in terms of low productivity from blindness and visual impairment is estimated at US dollars 2.9 to 5.3 billion annually, and it is increasing to 8 billion US dollars when trichosis is included. In 2023, 130,746 people received surgical treatment for advanced stage of disease, and 32.9 billion people were treated with antibiotics. Global antibiotic coverage in 2023 was 29%. We have already discussed the burden. This is the heat map of the trachoma, which is showing the areas of the world which are affected with the trachoma. Now, this is the distribution of trachoma in Pakistan, but no, Pakistan declared as eliminated the public health problem in October 2024. Now, globally, leading causes of vision impairment and at the number first are the refractive errors, cataract, age-related macular degeneration, glaucoma, diabetic retinopathy, corneal opacity, trachoma. Trachoma is the seventh leading cause of vision impairment when related to all the causes, but when it is considered as infectious causes, it is the first leading cause of infectious cause of irreversible blindness. And the second infectious cause is the onchocerciasis, that is also known as river blindness. Now, the epidemiological triad that is related to the agent, host, and environment. The agent factor includes, as I already told, that the chlamydia trachomatis is the causative agent. Its immune types include A, B, and C. It is an obligatory intracellular bacteria. The reservoir is in children with active disease, chronically infected older children and adults. Source of infection is ocular discharges of infected person and fomites. Communicability, it is low infectivity, infective as long as active lesions are present in the conjunctiva, but not after complete cicatrization. Host factors. These factors include children from the age of 2 to 5 years are the most infective. It is prevalent in younger age groups. In older age group, females has been found to be affected more than males. The predisposing factor includes direct sunlight, dust, smoke, irritants such as kajal, surma, and that may predispose to infection. The environment factors are the higher temperature and rainfall favors the increase in fly population. April to May and again during July to September are the more vulnerable seasons where the trachoma infection can occur. Quality of life. The disease thrives in conditions of poor housing, inadequate hygiene, crowded households, inadequate access to water, inadequate access to and use of sanitation. Now the mode of transmission. In communities where trachoma is endemic, eye-to-eye transmission can be considered as a rule. This may occur by direct or indirect contact with ocular discharges or infected persons or fomites, for example, infected fingers, towel, kajal, or surma. Now, the eye-seeking flies of Musca species are also responsible for transmission of trachoma that play some role in spreading the infection by mechanical transmission. In countries where only sporadic cases of trachoma occur, genital localization of trachoma, urethra cervical may lead to venereal transmission. It has also been shown that trachoma is familial disease. When one case is detected, others will also almost certainly be found in family group. The chlamydia trachomatis is also included as the sexually transmitted disease. Now, the routes of chlamydia trachomatis transmission and potential to halt its transmission. The person with ocular chlamydia trachomatis infection can spread the disease to others via the flies, fomites, eye fingers, and we can all prevent all these transmissions by face washing, hand hygiene, and flies transmission can be controlled by fly control, and fomites transmission can be controlled by sleeping patterns, laundry, and good hygienic measures in the houses. And finger transmission can again be prevented by hand and face washing. While from the animals and animal products and their fecal matters can be prevented by animal husbandry, waste disposal, and sanitary measures. The incubation period of trachomatis ranges from 5 to 12 days. Now, the clinical progression. An individual immune system can clear a single episode of infection, but in endemic communities, reconstitution of the organism occurs frequently, and after years of repeated infection, the inside of the eyelid can become so severely scarred that is known as trachomatis conjunctival scarring, that it turns inwards and causes the eyelashes to rub against the eyeball. That is called trachomatis trichiasis that results in constant pain and light intolerance. This and other alterations of the eye can lead to scarring of the cornea. If it is left untreated, this condition leads to the formation of irreversible opacities that results in visual impairment or the blindness. Age of onset. In very highly endemic communities, it can occur in childhood. Though onset of visual impairment between the ages of 30 and 40 years is more typical, women are blinded up to 4 times as often as men, probably due to their close contact with infected children and their resulting greater frequency of infection episodes. No, WHO has classified 5 stages of trachoma. As I already discussed, the pathogenesis of the trachoma. Here is its explanation of 5 stages. First stage is inflammation, that's follicle inflammation. This is the early infection. And the early infection has 5 or more follicles, small bumps that contain lymphocytes visible on the inner surface of the ear, of your upper eyelid. Next is the intense inflammation. Eye in this stage is high infection and becomes irritated with the thickening or swelling of the upper eyelid. The next is eyelid scarring. Repeated infections lead to the scarring of the inner eyelid. This scar often appear as white lines, and the eyelid may become distorted and may turn in entropion. Entropion is inward turning of the eyelids. Then is the trichiasis, that is the inward turning of the eyelashes. The scarred inner lining of your eyelid continues to deform, causing your lashes to turn in so they rub on and scratch the transparent outer surface of the cornea. Then there is the corneal opacity. The cornea becomes affected by an inflammation that is most commonly seen under your upper lid. Continuous inflammation compounded by scratching from the in turn lashes leads to the clouding of the cornea. These are the pictures showing the different stages of the trachoma infection. This is entropion, that is the inward turning of the eyelids. This is trichiasis, that you can see that the eyelashes are touching the cornea, and this is corneal opacity. Cornea is not visible as black, so this is the corneal opacity that leads to the blindness. Coming towards the symptoms of the trachoma, signs and symptoms of trachoma usually affect both eyes and may include mild itching and irritation of the eyes and eyelids, eye discharge containing mucus or pus, eyelid swelling, light sensitivity, that is photophobia, eye pain, dry redness, and vision loss. Now, this is the viscous cycle of blindness with trachoma that's related to the poverty. The poverty has that the peoples are living in crowding places, decrease access to water and access to the latrines. That leads to increased flies, and these communities have low knowledge about the cleanliness practices and lack of facial cleanliness. There is the episodes of infections and reinfections leading to the trachomatous inflammation, polychloride intense leading to the more severe cases of trachoma, that is conjunctival scarring, trichacid, and corneal opacity leading to the blindness, and this cycle continues. Now, the prevention and control strategies. WHO adopted the SAFE strategy. I will explain it later on in 1993. WHO's mandate is to provide leadership and coordination to international efforts aiming to eliminate trachoma as a public health problem and to report on progress towards that target. In 1996, WHO launched the WHO Alliance for the Global Elimination of Trachoma by 2020. The alliance, in partnership with supports implementation of the SAFE strategy by the member states and the strengthening of national capacity through epidemiological surveys, monitoring, surveillance, project evaluation, and resource mobilization. Now, here is the SAFE strategy. S stands for the surgery for advanced disease, that is for trichosis and tropion and corneal opacities, that is corneal transplant. Then the antibiotics to clear the chlamydia trachomatis infection. F stand for the facial cleanliness, and E is for improvement in the environmental conditions to reduce the transmission, that includes hygiene practices and flies control. Know the prevention strategy, environmental measures, modification, water use, fly control, data use, health education, and proximity to domestic and animals have all been proposed to reduce transmission. Use of insecticide sprays resulted in significant reductions of trachoma and fly density. Health education has also resulted in reduction. Antibiotic. WHO guidelines recommended that a region should receive community-based mass antibiotic treatment when the prevalence of active trachoma among 1 to 9-year-old children is greater than 10%. Subsequent annual treatment should be administered for 3 years. Annual treatment should continue until the prevalence drops below 5%. At lower prevalence, antibiotic treatment should be family-based. Now coming towards the management, that is that include the pharmaceutical products and the surgical interventions. The antibiotics recommended are the single oral dose of azithromycin at the dose of 20 mg per kg, or a topical 1% eye ointment of tetracycline twice a day for 6 weeks. And azithromycin is preferred one and more effective because it is used as a single oral dose. Now, the surgical interventions for individuals with trichiasis, a bilamellar tarsal rotation procedure is wanted to direct the lashes away from the eyeball. And next is the corneal transplantation for corneal clouding. Early intervention is beneficial as the rate of recurrence is higher in more advanced disease. Now, the elimination. Elimination of trachoma as a public health problem. It is defined as a prevalence of trachomatis trichiasis unknown to the health system of less than 0.2% in adults ages greater than or equal to 15 years, approximately 1 case per 1,000 total population. Prevalence of trachomatis inflammation follicular in children aged 1 to 9 years of less than 5%, sustained for at least 2 years in the absence of ongoing antibiotic mass treatment in each family endemic district. Plus, the existence of a system able to identify and manage incident trachomatis trichiasis cases using defined strategies with evidence of appropriate financial resources to implement those strategies. Know the trachoma elimination goals. As of December 2024, this is the current month, the World Health Organization has validated 21 countries as having eliminated trachoma as a public health problem. This is the list of those 21 countries. Now, this is the map that is showing the countries. In the green color, these are the countries which have been declared as they have eliminated trachoma as a public health problem. Pakistan is also included in this list. No, Pakistan in 19th century, 19, Pakistan is the 19th country worldwide to eliminate the trachoma. Pakistan is the latest country to eliminate the eye disease trachoma as a public health problem with support from site savers and other partners. No, this is the elimination of trachoma in Pakistan, a public health milestone. These are the initial data taken by the Pakistan to eliminate trachoma as a public health problem. Pakistan eliminated trachoma as a public health problem in October 2024, that is 3 months earlier, and Pakistan is ranked as a 19th country globally to eliminate trachoma. The key initiatives taken were National Trachoma Task Force that implements the SAFE strategy. Then Pakistan has the Pakistan Trachoma Elimination Project that focuses on safe strategy in underserved regions. Then the next initiative is integrated people-centered eye care that strengthens eye care integration in health systems. The impact is that it is valid by WHO for eliminating trachoma and inspiration for tackling neglected tropical diseases globally. A testament to Pakistan's commitment. This is all shows that a testament to Pakistan's commitment to the public health. Now, these are the some stats that shows that uh, uh, trachoma defeating the world's leading infectious cause of blindness. The target is eliminated as a public health problem. Progress is that number of people at risk fell from 1.5 billion people to 137 million people in 2020. That is 91% reduction. And 74% reduction in number of people with advanced disease, and 10 countries validated by WHO for achieving elimination. These are the previous stats taken from the 2020 years. This has been not been updated yet. The neglected tropical disease roadmap together towards 2030. The initiative that is from 2021 to 2030 build on three foundational pillars that support global efforts to control, eliminate, and eradicate neglected tropical disease. The pillar one is accelerate programmatic action, that is to reduce incidence, prevalence, morbidity, disability, and death. The next pillar is intensity cross-cutting approaches, that is to integrate in interventions, mainstream services, and coordinate action. Third pillar is change operating models and culture to facilitate country ownership. Clarify stakeholders' roles, understand cultures, and align to reach 2030 targets. Know the time for the recent updates. The first article that is included is a new surgical technique for post-operative trachomatis trichosis. The WHO has identified management of post-operative trichosis as one of the key remaining areas of focus needed to eliminate blinding trachoma as a public health problem. They developed a bevel rotation advancement procedure that is abbreviated as BRAP to treat individuals who need repeat trichosis surgery. The methodology is that scarring caused by trichosis surgery can cause the eyelid to become thick and distorted, making repeat surgery more difficult. To minimize eyelid thickness, followed BRAP, a beveled incision of the process is made allowing a marginal rotation of the eyelash fragment. Dissection between the anterior and posterior lamella above the bevel incision and removal of the scar tissue allows the marginal rotation to be combined with the posterior lamellar advancement to treat severely scarred eyelids with post-operative trichosis and eyelid continuous abnormality. The result shows that two surgeons performed B-RAP on 44 eyelids, 30 patients with PTT. The number of prior trichosis surgeries range from two to more than four. At the 3 to 6 month post-operative visit, 36 eyelids had no recurrence of trichosis. Three eyelids had central lashes touching. The remaining eyelids with recurrent PTT had nasal or temporal lashes touching. 15 eyelids had ECS, but only one was severe. They concluded that BRAP was developed considering the altered eyelid anatomy found in the post-surgical eyelid with TT. Thickening of the eyelid fragment and removal of post-operative scar tissue improved the ability to advance and stabilize the eyelid fragment after external rotation. BRAP shows promise as a procedure for improving outcomes of the repeat trichosis surgery. The next article that is included as a recent update is medicinal plants and phytochemicals effective against chlamydia trachomatis, the positive agent for the trachoma. The conventional antibiotics are used for trachoma treatment. However, the pathogenic bacterium complicated life cycle is a challenge to the treatment for their reduced sensitivities to the conventional drug. Thus, options are sorted in phytochemicals effective against trachoma as a treatment strategy. Literature has identified the following phytochemicals, that is bicillin, berberine, catechins, coumarins, and curcumin, among others, as active compound from plants to treat trachoma. Now the time for the MCQs. First MCQ is trachoma is a public health problem in 44 countries. Which of one of the following is true about the prevalence of active trachoma? Whether the prevalence of active trachoma increases with age, although the prevalence rates of active trachoma are similar in males and females, the later circulate tricases, ectropion, corneal opacification, and are more common in women than men. Or the C option is the global prevalence of active trachoma is 12 million cases. Second leading cause of infectious disease blindness, first being the oncocytic cases. E option is active trachoma predominantly affects individuals over 50 years of age. Which one is the correct option?
B.
Yes, it's B. Second MCQ is which of the following patients with trachoma, as defined by the WHO simplified grading system, are at highest risk of blindness? Whether patient with trachomatis inflammation follicular, patient with trachomatis inflammation intense, patient with trachomatis scarring C, patient with trachomatis trichosis, or patient with active trachoma but no visible corneal damage.
A.
No, the patient with trichosis, those patients who are having inward turning of
E.
eyelashes that touch the cornea and leads to the corneal inflammation leading to opacity and blindness. So, according to WHO classification grading, the highest risk of blindness is by trichiasis. So, D is the correct option. Third option A, third MCQ is trachoma is a disease of eyes that may cause visual impairment and blindness if left untreated. Which of the following population is at lowest risk of contracting the disease? Whether the population living in conditions of poor and overcrowding housing, inadequate hygiene, inadequate access to water and sanitation. B option is in regions of high temperature and rainfall. C option is adult females have 4 times less chances for developing visual impairment and blindness. D option is in regions with lowest density of flies. E option is children under 15 living in fly infested regions. Which of the following population is at lowest risk of contracting the disease? It is obvious from the options that the population that has the lowest density of the flies will be at the lowest risk of contracting the disease. So D is the correct option. Fourth MCQ is a 4 years old child belongs to a well-groomed family, recently come from Ethiopia, presented to their family physician with complaints of red eyes, with discharge from eyes, irritation, and photophobia. He never experienced this before. The doctor suspects him a case of trachoma. His parents worried about his vision loss. Or the doctor should have to counsel them. The disease once occurred leads to permanent vision loss. Surgery is the only option to prevent blindness. A series of repeated infections may lead to blindness. There is no use of good hygienic measures to prevent reinfection of visual loss. And the E option, antibiotic treatment, has no role in managing the infection. Or the doctor has to counsel the parents of the child. C is the correct option, as the repeated infections may lead to the blindness. Fifth MCQ is which of the following is true about the WHO's safe strategy to reduce transmission of chlamydia trachomatis? Single oral dose of azithromycin is more effective for managing trachoma than topical tetracyclines. All 4 components of the strategy have been proven effective in multiple randomized controlled trials. With this strategy, the WHO is aiming to eliminate trachoma by the year 2040. Surgery is the most effective and faster method for preventing trachoma. The WHO safe strategy focuses only on antibiotic treatment to reduce transmission of chlamydia trachomatis. Kindly switch off your mics. Which is the correct option relating to the safe strategy? A single oral dose of azithromycin is more effective for managing trachoma than topical tetracycline. As we have learned in this presentation that the single oral dose of azithromycin at a dose of 20 mg per kg is more effective than tetracycline, whose doses are dropped twice daily for 6 weeks. So, azithromycin is more effective. Sixth MCQ is you have been appointed as a district health officer of District Dera Ghazi Khan and you notice a huge number of patients infected with trachoma. Which public health measures you will adopt in district to prevent the spread of trachoma? Whether mass drug administration of a single oral dose of azithromycin when the prevalence of active trachoma among 1 to 9-year-old children is greater than 5%. Subsequent annual mass antibiotic treatment should be administered for at least 5 years. Annual antibiotic treatment should continue until the prevalence drops below 5%. Only health education regarding frequent face washing and insecticide spray are sufficient. Mass drug administration should be discontinued after one dose regardless of the prevalence.
C option.
Yes, it's the C option. Annual antibiotic treatment should continue until the prevalence drops to 5%. Seventh MCQ is a 32-year-old beggar presented in IOPD with red and swollen eye. On examination, his eyelashes have moved inward, that is diastasis, toward the eyeball and touching the cornea, with visual acuity of 5 by 6 in both eyes. Which treatment option is best for him to prevent visual impairment? Whether best practice facial cleanliness and avoid touching his eyes with fingers, a combination of oral and topical antibiotics, surgery to remove the eyelashes touching the cornea, frequent cold water splitting in eyes, prescribe lubricating eye drops, and monitor for further complications. It's C. For inward turning of eyelashes, surgery is required to prevent blindness. Eighth MCQ is you are working as an airport medical officer in Jeddah, Saudi Arabia. One Hajj pilgrim with his family from Sudan seeks your medical assistance for his ongoing trachoma infection. What will you advise for prevention and management of trachoma? Whether avoid too much physical activity, avoid using other towels and clothes, remains quarantined for 1 month, prescribe antibiotics to him alone, advise mass antibiotic treatment for the entire family, and maintain good hygienic practices. The best advice for this pilgrim will be E. Advise mass antibiotic treatment for the family members and maintain good hygienic practices. Ninth MCQ is the literature review suggests that adult females develop 4 times more trachoma-induced blindness as compared to males due to which reason? Whether more usage of eye makeup, close contact with children, venereal disease also affects eyes, decreased immunity in females, poor access to healthcare services.
A.
It can be also be the reason, but the most common reason is close contact of women with their children. So B is the correct option. 10th MCQ is the picture shown in figure is of 35 years old man who is suffering from trachoma. Is at which stage of disease? You can see his cornea, the sclera, the eyelids, and the eyelashes. Identify the picture. Identify which stage of disease is this. Whether inflamed conjunctiva, entropion, trichiasis, corneal or cicatricial trachoma. It's trichiasis. As you can see in the picture, that the upper eyelashes are touching his cornea. The eyelashes have been moved inward. This condition is known as trichiasis, and surgery is needed to correct it. This is the key of the MCQs. This is our YouTube channel where all the presentations of the postgraduate results are uploaded there. And thank you very much for today's presentation. If anyone has any question, uh, you can ask. Otherwise, we are going to finish this presentation.
अबू जी आने वाला रिक्शा, आप दरवाजा बंद कर लो।